I'm going to present the Flail Arm Syndrome, the influence of phenotypic features. ALS has several phenotypic subtypes with different prognoses. The Flail Arm Syndrome is characterized by slow progression, predominant lower motor neuron involvement with proximal upper limb weakness. We aim to characterize the clinical features of flail arm associated with distal or proximal onset and presence or absence of upper motor neuron signs at diagnosis and explore progression and survival. From the 190 patients with upper limb onset, 134 were excluded according to the definition of flail arm syndrome. A final cohort of 56 flail arm patients was included. Distal onset was more common and symmetric onset was rare. The clinical characteristics are similar to what has been described before. About half of the patients had upper motor neuron signs at diagnosis, mostly in the lower limbs, but also in other regions. Flail arm patients were divided into 4 groups according to distal or proximal onset and presence or absence of upper motor neuron signs at diagnosis. No clinical differences were found among the 4 groups. However, when we compared those with or without upper motor neuron signs, we found that patients with upper motor neuron signs had more balanced sex ratio and a median shorter survival, but time to respiratory involvement and NIV adaptation was similar. Also, the Cox regression model identified rate of progression and upper motor neuron signs as independent predictors of shorter survival. As a conclusion, the emblematic phenotype person in a barrel is not a common initial presentation of flail arm syndrome. Distal or proximal onset had no influence on clinical characteristics and prognosis. Although considered a lower motor neuron phenotype, half of flail arm patients also had upper motor neuron signs at diagnosis. The median survival time of flail arm patients with upper motor neuron signs is reduced by half when compared to patients without. Even though flail arm has better prognosis than classic ALS, the presence of upper motor neuron signs at diagnosis is a negative prognostic predictor. Although often difficult to elicit in patients with motor neuron disease, upper motor neuron signs are important clinical features to take into account at diagnosis. Thank you.